body's organs and systems are shutting down. This is caused by a lack of perfusion to tissue. So we talked about that. Different events can cause shock, but for the most part, the manifestations are ultimately the same. Interventions is the same minus the positions of the patient's position for neurogenic shock. So this is important. If you have shock, the organs and systems are shutting down, the shock position is usually supine with legs elevated. So this is your dude. This is how we position them. Supine, the bed is flat, the legs are elevated because it still facilitates the gravitational pull of blood to the vital organs. However, if you have neurogenic shock, that means that you've damaged the vertebrae, the spinal cord, the back, somewhere in your vertebrae, right? And what's the rule when you find someone with trauma that has damage to the back of the head? You don't move the limb. So those patients, you can't put them in the supine with legs elevated because you're moving the legs. You're going to potentiate further damage. These are the ones that you put in the Trendelenburg position. Okay. You put the patient is still maintaining, that's a little too high, but you guys get the gist. They're still maintaining their anatomical position of being straight. They're not moving anything, but the gravity is still pushing or pulling blood to the vital organs. So your Trendelenburg position would be for patients who have neurogenic shock. Okay. And then, all right, medication treatment, we give epinephrine, dopamine, dobutamine. All of these medications help increase the heart rate and help maximize perfusion to organs. The one that he really wanted us to know about is epinephrine. It's a sympathomimetic. It mimics the fight or flight system. It constricts peripheral blood vessels. It shunts blood to the vital organs. It increases contractility of the heart, which perfuses organs better. It bronchodilates, which allows more air to come inside, so we can oxygenate the blood better. And that's usually the intervention. Signs and symptoms include tachycardia, hypotension, tachypnea, obtundation, the patient's stuck on stupid, cold clammy skin. Mottled skin is when the skin looks blotchy because the circulation, the perfusion is inadequate. Oliguria, again, we're looking for trends, right? What if the patient had like 70 mLs per hour and then suddenly they have like 45 mLs per hour within like an hour or two? That's a significant drop. That's that trend that I was talking about. That you should pay attention to that. Let's see, oliguria, metabolic acidosis. People that have a lack of perfusion to tissues, their muscles release lactic acid. This is what's going to happen. And so you may develop a metabolic acidosis because of that. Hypernatremia occurs because of the lack of fluids. The salt is concentrated, and hyperlactatemia, that's the excessive lactic acid. If your body is shutting down, like I mentioned earlier, your kidneys will will stop working. So you may develop acute kidney injury. You want to assess the glomerular filtration rate, the blood urea, nitrogen, and creatinine levels. These lab values are really important because they let us know how the kidney is functioning. Remember that your GFR is about 100 mLs per minute. That's just describing how much blood goes to the kidneys every minute, not how much not how much urine is being made. This is just how much perfusion is getting to the kidney. So GFR, 100 mLs per minute. Some books say 90 to 110, 90 to 120, but it's around there. Your BUN is assessing your urea and nitrogen, which should be between 10 to 20. Keep in mind that if you have kidney failure, your BUN will be elevated, but so will your creatinine, which is a much better assessment, a much better tool to assess kidney function. It should be 0.6 to 1.2. But if the patient is just dehydrated, your BUN will also be elevated in dehydration, but your creatinine will be normal. That's how we know, oh, this is just dehydration, not kidney issues. And of course, when the patient is experiencing these things, you keep them NPO.